We have 38 participants.
Okay, so I think we can start. Okay, good afternoon, everyone.
All right, good afternoon.
Good afternoon. Hold on. I wanted to show my video. Trying to. Yes, hi, can everyone see me?
Yes, now we
Yes.
see.
Nice background.
Thank you. Good afternoon. Welcome to Chicago Cancer Health Equity Collaborative, also known as Chicago Czech Virtual Community Conversations. I'm Beverly Chukwudozie. I'm a project director for Chicago Czech at the University of Illinois at Chicago. Chicago Czech is an NCI, National Cancer Institute Comprehensive Cancer Partnership with Northwestern University, Northeastern Illinois University, and the University of Illinois at Chicago. The mission of the partnership is to advance cancer health equity through meaningful scientific discovery, education, training, and community engagement. The main focus of today is to provide an avenue to share experiences, challenges, resources related to COVID-19 outbreak. Today's conversation will be in English, and we're hoping to have future conversations in other languages. Here are a few ways that you can reach us at Chicago Czech. We're on, here's our email, our website, and our Facebook, and we can also be reached on Twitter as well. So I want to introduce our facilitators for today. Aida Gachello, Dr. Gachello is also a Chicago Czech Community Engagement Corps co-lead, and she's a research professor of preventive medicine at Northwestern University of Feinberg School of Medicine. We also have Joanne Glenn, who is an RN and an MBA. She's our Chicago Czech Community Steering Committee co-chair. She is in and out today flying, so she might be joining us shortly if she's not on the call already. She's also the founder and president of Women on Top of Their Game Foundation. And we also want to acknowledge Henrietta Barcelo, who is also part of, she's on a call with us today. She's also the Chicago Czech Community Steering Committee co-chair. So I also want to thank all our Community Engagement Corps co-leads and staff, community health educators that helped us prepare for this conversation, and hopefully we'll be bringing this to you monthly. And also want to acknowledge those that will be sharing information on the call today, like Melissa, Alicia, and Edgardo. So thank you, and Aida, I will let you take over now.
Sure. Well, first of all, good morning or good afternoon. Thank you for your taking time out of your busy schedule to be able to be part of this conversation. This is a very informal dialogue with all of you, focusing on people that have been touched by cancer, which may include caregiver, cancer survivor, people living with cancer, etc. And so let me begin by starting that all of you, or most of you, before you registered, you may have filled out a mini survey where we asked what were the top 3 resources do you think are priorities in your community. And so this particular chart provides some of the key findings or responses received by many of you. And clearly, many of you mentioned that food security and financial security were top issue. Can anyone in the line be able to share what exactly you think is happening in the community that you feel the food security and financial security, which tend to go together, are happening in your respective community, particularly impacting people living with cancer or touching the life of people with cancer? Who may want to share their thoughts about why in this particular survey, these 2 top items were given as top priorities in your community? Who may want to start?
Okay, I'll go.
Great, thank you.
Well, one of the things I see well, with food security is there's a lot of price gouging going on in a lot of stores. Even your you know, stores, your top stores like Jewel and even Mariano's and places like that. They're really raising the prices on a lot of very essential items. And of course, that's related to financial security, because right now with people out and on quarantine and all these things and not working and not having enough money to get things done, and then they gave that little cheesy $1,200. I mean, like you can do something with that. That's a real challenge that I think people are facing now and will be facing in the future, because, you know, I think, as all of us probably on the line know, this thing is not going to end in the end of the month or the end of the year or even the middle or the end of next year, because there's so much stuff that has to go on in terms of, you know, finding the right kind of balance in terms of a cure, trying to find you know, doing the testing, then finding the manufacturer, then pricing. You know, I think most of us here know that there's a whole series of things that need to be done before this thing is going to be established. And so this is going to be a real challenge for our communities over the next couple of years, really. Not to mention, you know, getting back to school and the stresses of and the trauma of just the experience of not knowing how things are going to go from day to day.
Thank you so much, Joseph. You mentioned a lot of things there, and some of them were actually mentioned in the survey responses. Who tend to agree with Joseph that in terms of food security, even if you may have money to pay for your grocery items, you may find it difficult, based on what he said, find it difficult to get them in the different store that you usually do your grocery shopping? Who may want to express that further, or who tend to agree with his comment?
This is Rosemary. I think we all can agree to that. You know, as I said, since January, I've been in because I broke my foot in 3 places. So
Wow.
I've had friends who've been helping me with my grocery shopping, but since everything shut down, I've had to use like Instacart for groceries, and to see how the prices have gone up. You know, I think it's ridiculous. I mean, I'm retired, and I'll be honest, I can afford it more than others that I know.
Mm-hmm.
But to see how basic things have just gotten out of control, you know, I think, you know, they talk about price gouging. I can't imagine a family with 3 or 4 people in it being able to afford groceries right now. So I think there's, you know, they want to blame one group, but I think overall, I think that grocery stores are taking advantage of people.
Yes.
And, you know, as I say, I have Instacart bringing, and I've been watching on the news how people have been using Instacart, and they put a tip on, and then after the groceries are delivered, they take the entire tip off. Mm-hmm. And I said, the average person out there delivering groceries right now, that was not their normal job. They've created a job for themselves to help themselves out. Mm-hmm. And it's so frustrating in our society today that so much is based on the me. And people don't think about that other person and what they're doing to help us out as individuals.
Absolutely. Thank you, Rosemary, for sharing those experiences. And I'm sorry to hear that you've been with some kind of disability during this period on top of everything else. Who have a different perspective?
Can I make a comment about that, Dolores?
Yeah, Dolores, go ahead.
Yeah, the thing is, in Little Village, a lot of people not had access to food. We had 2 big places they can go get food, but it's not enough. But a lot of people called me and told me, like a senior citizen, they not had place to get food because they not had documentation. And we tried to coordinate somebody to bring food to them, but the situation over here, a lot of people not had money to buy anything. And the reason, and I agree, in the stores, they raising the prices, and it's insane, but the situation here is the way we do it right now, neighbors passing food to another neighbor, for example, someone who has beans passing to someone who has rice, and pass food like that, you know, when you know have something, you ask your neighbor and your neighbor helping you. But I wonder how long we can do that, you know, like, because we don't know how long we're gonna have this pandemic, and how sustainable can be for the community doing that kind of stuff. I don't know. It's a difficult moment for everyone, and it's specific for some communities, like brown and black communities. We're going through so much right now, and the other thing, people die constantly, and no money for funerals, and they don't know what to do, and that is a lot. Yeah.
Well, thank you for sharing that perspective about the immigrant, undocumented individuals, the poor, and experiences, particularly among brown and black community that you mentioned. For sure, you know, I guess we all agree that we are really living in very difficult times, and it's hurting some groups more than others. You did mention that you're trying, Dolores, to help your neighbors and friends in getting food and other items that they may need. Alicia, later on today in this presentation, she's going to be sharing you some of the linkage that you could be able to access in obtaining food, in obtaining shelter, in obtaining a number of resources, many of them listed in this chart that many have already viewed as a priority. So we're going to have a demonstration about what are some of the most often needs people have, and we're going to make sure that you leave this webinar with some clear understanding about where the resources are and how can you access them. Now, moving on for a couple more minutes, how about the issues of healthcare that appears like number 3? What are some of the issues that you see during this pandemic that has to do with access to services, to medical services, and healthcare? And particularly for people that have been touched with cancer. Can anyone elaborate about why that issue emerged as number 3 in this ranking of top priorities in the community?
So this is Henrietta. I would like to make a comment on that. I've been trying to help some of my elderly neighbors and my family with medical visits. And this idea of telemedicine is really foreign to a lot of older people. Mm-hmm. And they're the highest risk. That, you know, the people that I'm helping with have diabetes, heart disease, and they have these challenges. If I were not there with the telephone and helping them palpitate and talk to the physician and showing, I think a lot of people, and I'm just not saying seniors, but I think a lot of people would have difficulty doing that. I don't know how effective those telemedicine visits are. It makes me wonder, because my brother, for example, is undereducated. He does have, you know, diabetes and a little overweight and heart disease, and he has a speech impediment as well. So if somebody like myself were not available to talk to the doctor, phone up and show where his ailment or what was bothering him, it would have been very difficult to have a productive doctor's visit.
Thank you for sharing those experiences, Henrietta. I guess we all have a family member, a friend, a neighbor that are experiencing very difficult time in terms of access and utilizing healthcare. Anyone in the line wants to share any of those experiences as it relates to access to care or use of services, medical services during this period?
Can I share my experience? And Dolores again. My 2 brothers, they have COVID-19, and my brother, they don't have access to medical care because they don't have insurance. The place they working, they never provide insurance to them. And in the workplace, 2 people died for COVID-19, but they not close that place. Even I call OSHA, I call Public Health, and I report that company, but nobody do anything. But the situation with my brothers, they went to UIC to be testing. And I'm glad, you know, we had a service for the community. And it's the only resource they have because they don't have a specific doctor for them. You know, they don't have doctor because they don't have insurance, but I'm glad we had opportunity even to go to get care in UIC and the one in the one in Good in Ogden, the clinic, that one. And but the experience was good to know they positive and they called them the nurse, even they know insurance, they call them and check in, everything is fine. And yeah, it's a plus for us and for the community to have that access, that kind of access at least, you know, be cared about COVID-19.
Aida, no entendí bien qué dice la señora.
Yeah, Dolores is basically sharing the fact that 2 of her brothers were COVID-19 positive, and they tried to figure out where can they go to be able to be tested and be treated with respect and dignity. And they ended up finding a clinic around Marshall Square, I think you mentioned, Dolores.
No, es la que está en la Good in la Ogden.
Miles Square is the Miles Square main center.
Miles Square, thank you.
Yeah,
Miles Square
yeah.
Clinic. And she said that they really felt very welcome. They felt welcome, and she feels that her brother got the care, the testing, and the care that they were looking for at that moment, regardless of whether they have insurance or not, because they don't. Did I capture that correctly?
Yeah, and then the other thing, I recommend more people from the community to go over there and they have good experience. And I like that kind of resource because that way, you know, they really respect the people, respect the community, they care. Because I don't like to refer people when they don't feel comfortable, but a lot of the people I refer that they had a good experience, and I'm glad to hear that.
Oh, no, porque I was trying to mention, Aida, that in 1713, South Ashland, they have a clinic for coronavirus for the Spanish-speaking people in Pilsen. It's Ashland and 18, in between 17 and 18. So they can call, but I can send you the number, or I can say the number now for an appointment. And they can treat even the comorbidity. I mean, if the people have diabetes or hypertension, they can deal with that too, okay, for the immigrant community.
Well, thank you, Esther. Put that in the chat, the telephone number and the address, so everybody else in this webinar can be able to see it. And so I guess the conversation is moving into testing, which happened to be listed also in one of the priority as number 1, 2, 3, 4, 5 in the ranking. Can anybody else share their experiences about having knowledge about where to go for testing, or what has happened or did not happen? How many of you may have to wait longer time to be seen for testing or longer time to get your results? Can anyone speak about that?
I'd like to know how many of us have been tested.
This is Rosemary. I actually got tested last week, but prior to last week, and I live out in the south suburbs, I'm not in the city. And one of the concerns of some of my friends and neighbors were the only testing site that they had for the longest was at 115th Street in Chicago. So for those who live out in the south suburbs, well, I take that back. They did have a location over in Orland Park. But people who live southeast of the expressway have been kind of excluded from certain things, areas like Richton Park, Chicago Heights, Creek, and those areas. So, you know, for them to have to go into the city to get tested, a lot of them were avoiding doing it. Now they opened up a site out in 159th Street. And actually, when I went over there, the place was empty. I was able to go right in and get tested. So I know people complain out here about not getting things. And then when they put something out here, people aren't taking advantage of it. And certain areas here in the south suburbs have high incidences of COVID-19. So it's one of those, you know, people say the have and have nots. Those in the city are going to the sites and they can't get in because so many people are being tested. Then you have locations out here where no one's going to get tested.
Right, I have heard about that, and part has to do with a little promotional effort that has been made by the organizer of those testing sites. They don't really inform the community that they're open, because I have heard that there have been a couple of sites, testing sites, that they have very few people, you know, utilizing those the services in those sites. Any other comment about? Go ahead.
Yeah, I have a comment. This is Jeanette Gonzalez. Hi, everybody.
Hi, Jeanette.
Recently, you know, I know there's a lot of free testing sites, but as much publicity as there is out there, there's still people that think that they have to pay for this test. I just found out the other day the physician immediate care clinics are charging people with no insurance $240.
Wow.
To get tested, and then they say that the reason they're charging is because they're also going to do a physical exam. So, you know, and people don't know where they can go and they really want their test result immediately, they dish out the money. And I think that's so predatory and so unfortunate that given that there's so many free clinics that people still think that they have to pay for a COVID-19.
Anybody else have similar experiences want to share about the cost of testing?
Hi, this is Mariana Martinez, and I'm from Rush Copley in Aurora, so I'm a little bit farther out than probably the majority. I wanted to refer back to the healthcare and medical access specific for cancer patients.
Yeah.
We've seen a delay a little bit within Medicaid when patients maybe lose their private insurance coverage, and this is for cancer treatment patients, getting their Medicaid expedited. We have a patient who was struggling with that for several weeks already. And then I think for cancer patients that are losing insurance coverage, it's their prescription medications that are kind of a barrier and really trying to get the access to them as soon as possible. That's probably some of the issues that I've seen within the cancer realm. And then obviously our patients who don't qualify for insurance coverage, kind of really getting access to them as well.
So how have you been able to help those individuals that are experiencing delay, and that you associate that because they are covered under Medicaid and not private insurance?
For us right now, we continue, but we're just waiting for that Medicaid approval. That's what's taking a little bit longer than what we expected.
Very good. Thank you, Mariana. Oh, thank you, Mariana, for sharing that. Anyone else have a different perspective, either on healthcare or testing, or any of the listing of issues that all of you were able, or many of you were able to identify as issues of top priorities in your community?
I just think I wanted to also add in terms of why people aren't taking advantage of testing. I also have heard of a lot of people in the community that have shared with me that they go for testing and when they show up, there's long lines. And so the fear of standing in line and being exposed if they are negative to COVID-19 makes them reluctant to go and get tested. So, you know, I think there's a lot more sites that are needed that are drive-through so that people can feel more comfortable going to get tested.
And I know earlier it was mentioned by Rosemary that there is one in 115. Remember that the whole attention, particularly on community of color, primarily has been the results of the intensive effort of getting to the attention to the media that this is impacting African American and Latino disproportionately. So the city is making an effort, and the state as well, in opening new sites in the barrios, in the Latino and in African American neighborhoods, so they can be able to access testing site. And they also have mobile unit in many localities through Roseland Hospital that are providing as well testing, and the mobile unit goes to the given location requested for. So there's a lot more effort. There has to be more promotion of those sites. You have to go to the IDPH website in the city of Chicago to know which is the testing site close to you. And obviously, unfortunately, you are correct. Some sites are, charging for the tests when many of the site has been given federal funding to make the test free, but it's not happening. And we've been hearing a lot of complaints about that. Any other comments on any of the listing that you see in this chart here?
No, excuse me, this is Rosemary again. And I know a lot of you who are on the call, some of you I may not know. And I'd like to share one little incident that has happened since I've been able to get out. As I said, I've been in since January. I had to have surgery on my foot. And actually, right after I got the stitches taken out was when everything closed down. So trying to get into rehab and everything, I couldn't do it. And they told me to, do my therapy with YouTube. So about 2 weeks ago, I had to go and have an x-ray done of my foot to see if it was healing okay. I had that done and they said, if I could find some place to go for therapy. I live here in Richton Park. I don't know if any of you are familiar with that. It's 224th and Cicero. But there was a place that I had been to for physical therapy in Frankfurt several years ago, and I was familiar with it. So I decided to go over there and have the therapy on my foot there. And I was assured that when I went, I was in a room with the person in charge having therapy. So as we were in the room and I'm talking with the owner and everything, I looked out and I noticed there were 2 other people there who didn't have masks on. Well, they came in after I had gotten there and I was in the room and they really couldn't see me. But when we talk about the issues of the haves and have-nots, I listened to a conversation from these 2 people who happened to be Caucasian. And what they were talking about was they didn't feel that they needed to wear a mask because even though this disease affected them, they weren't the ones dying from it. It was those other people who were dying, and they felt that they didn't have to put on a mask. So the owner looked at me, I looked at him, I was getting ready to leave. And when we walked out, these 2 people looked at me in shock. And I said, that goes to the strength of what we're seeing on TV about those who feel they've got to get back out, nothing has happened, nothing is going to happen to them. It is so disheartening to hear that and to see people still, like I said, I went to therapy yesterday. I stopped in the grocery store and to see the people in the grocery store who didn't have masks on. And I looked at this one woman and I said, aren't you supposed to have a mask on? And her comment back to me was, you're the one who'll die, not me.
Oh.
Oh, that's terrible.
No, that's common. There are 3 words that I've heard regularly used, and that's a different, they're code words, a different demographic. They'll use terms like, well, that happens to those people over there, or they'll say it doesn't happen to regular people. And so this is also beginning to come out as we see, I guess you might really see the coding of health disparities, especially in terms of this kind of racialized coding that is used. And this is unfortunate because COVID-19 doesn't respect who you look, or what you look like, where you come from, or where you go. And we're going to find this out real quick in the next couple of months or so as things open up. Now, Rosemary, in response to your thing about the mask, yes, I see a lot of that in the city with people out here jogging and everything. But you cannot go into a store in Chicago without a mask on.
And I thought that was a statewide.
No, it doesn't seem like that. Yeah.
And I mean, it just really, that certain things happen, but it's when it's put right in your face. And again, it's this confrontational thing. You know, I'm still on one crutch now. So I had the one crutch and I'm trying to get my vegetables. And for this woman to look at me and say, it happens to you, it doesn't happen to me. You're not going to get, I'm not going to get into an argument with someone about it. But it's like, when will it ever change that it is us versus them and things only happen to certain people?
Yeah, it is very unfortunate that the whole, you know, attitudes about race and social discrimination and all that has been combined. And because we, unfortunately, Latinos and African American disproportionately is being impacted by this pandemic, now they're starting to say it's a problem that affect only people of color and does not affect the general population. The other issue is that there is, you know, confusion in the message from the White House to the state level. You know, the White House, the president says that it's optional, that people don't have to really use it. At the state level, they really want to enforce that. I know that my experience, I live in Oakland, and I only went out this weekend to buy some vegetables for my garden, that I like to work on my garden during this period. And I couldn't get into any other Millard or Home Depot unless I had a mask on. So it really depends the enforcement in the different villages or city if you are outside the city of Chicago. But in Chicago, it's supposed to be mandatory. And in many localities throughout the state, it's also mandatory, except that there's a number of, as you probably know, geographical area. They have been challenging the governor legally, arguing that they want the economy to be open and that they are not at risk for getting, you know, the virus. Any other comment about this issue or any other issue from the listing that you see here? How many of you have problem getting cancer resources during this period, for example?
Well, my mammogram has been put off a couple of times, so now it's scheduled for June, you know, and I am a cancer survivor. I mean, I don't worry about if I don't get it, will something happen? But I just think of people who, you know, I have a friend who does have cancer and her trying to get in and get her treatments. You know, it's added that extra burden of anxiety on her. As, you know, I'm going through one thing and then I have to go into the hospital that's a high risk area and deal, you know, that mentality, because it's been put out on the news, you know, don't go near the hospitals, don't go near. So someone who's battling cancer right now and having to go in, that's been an issue for them. Do I go in for my treatment or do I stay here at home and wait?
Well, in the beginning, some of the hospital and physician and clinic were discouraging people from utilizing health services other than COVID-related condition. And the word was that you may get infected if you go for another type of care. So I don't know how much has to do with those messaging going out that don't go to the doctor or don't go to the hospital. I personally have friends of mine with cancer. They couldn't do, you know, the same thing as your friend, could not go for their regular chemotherapy. And the hospital just told them, you have to wait so you don't get infected if you come in.
Yeah. And that's the hard part. They're starting to tell people, oh, well, you can come in for your visits, but they're not pushing that message enough now as they were initially to not come. So, you know, there are a lot of people who have that fear and trying to convince them that you can't say it's 100% safe, but you can say you can go in for other treatments now. So I think, you know, they got to figure out a way to balance the two of come on in for your treatment. So something else to deal with.
Ms. Rosemary, sorry.
Erica, you want to say something? Go ahead.
Yes, I was just going to say thank you much for sharing that. I think that's really important for all of us who work with patients and also in the community in a different way to start to be able to message that, you know, we need to go back to making sure that people can get care, but we want to make sure that we have a really good understanding from our own health systems and how we're going to do that safely. So I think it's really important in terms of what you bring up, because there's a lot of anxiety, I think, and fear. I mean, I took my dad to the doctor on Monday, and, you know, I was super anxious to just be in the waiting room. And, you know, I was just like on pins and needles to say, when are they going to see him? So I think it's really important as we're working with cancer patients, but even for ourselves and our family, that, you know, we kind of make sure that we know the protocols and also make the organizations accountable for them. So thank you for that. I think messaging is something that we're definitely gonna make sure that the Cancer Center navigators are beginning to really focus on.
Thank you for those comments, Erica, and contributing in terms of using that information to improve the way in which the Cancer Center at UIC is running their business and getting people back. Any other comment that has to do with responses from the survey that many of you fill out? And anything from this list? There's someone or two that mentioned grief as one of the concerns in top priority in their community. I don't know if any of you want to address that. There was patient support navigation that was also mentioned here, and many other health insurance issue, mental health. Can anybody speak about either mental health and stress management or patient navigation or any grief, any of those issues that we haven't touched yet?
Yeah, Aida, this is Jeanette Gonzalez again from University of Illinois Cancer Center. I've participated from quite a few webinars recently in Spanish about grief in the Latino community, grief in general for everyone. And I think when we think about grief, we all think about grief in the sense of we lost someone, right? But I think that, you know, the grief that we're talking about now is the grief that we're all of us are experiencing right now, is that we're grieving that the life that we used to know is no longer the way it used to be, right? It's no longer the way it is now. So I think there's that kind of grief that people are not addressing and are not dealing with. And we're having a high number of people now suffering from anxiety and depression that may have not previously suffered from it due to this change and due to the grief that this change in the world has caused them. So, you know, I think mental health services as it is so limited. I think that's a big issue in our community, that that people are not getting those services, even less now that we're all sheltering in place.
Well, thank you for saying that. And in reality, we are going, you know, to different stages of emotion as a result of the experiences that we are personally experiencing during this pandemic, that many people have to be staying at home. Can anyone share any suggestion? How can you be able to deal with some of that? And I know that Alicia in a few minutes is going to be telling you what are the different resources to deal with this kind of emotional experiences. Dolores, you want to say something?
Yeah. Yes, I want to say we need a healing moment. And we had experience last Tuesday. We had a Zoom with different people from the community to be in the healing moment. And people make a comment was very helpful, because right now we need to just thinking and breathe and, you know, thinking what we're gonna do, because it's so many issues around our communities, and sometimes we not focus. And I understand that point, but I think we need a lot of healing and a lot of working together and how we can support mentally, because we know already, we don't have the access to mental clinics, and we don't have the money to pay or nothing like that. And in one point, we need to start working together like community, or maybe you can support us to put like a something therapist to talk to us about what we can do in home to relax a little bit, to healing, and try to continue living the pandemic, because we can do a lot with this pandemic. I don't know, you have some suggestions about it, how we can do healing moments with communities?
Right. And the unfortunate part is that, at least for many for many of us, religion is very important, you know, faith, and not being able to go to church and not be able to participate as we usually do into, you know, religious ceremony. They could also give that comfort emotionally and otherwise, you know, right now it's not accessible. I guess they're going to start opening the churches, I guess in the beginning of June. But you are correct. There are things that you could do at home, from exercising or walking around the neighborhood if you have the possibility of doing that, and be able to look at some of the video for physical activity and connect through Zoom with your relative. I talk to my family every night around 7 o'clock, and we all see each other in Zoom and talk and relax about what's going on in everybody's life. And so we feel a sense of connection, but not everybody have the capability or the computer or know how to use Zoom to be able to connect with other family members and friends. Any idea that any of you may have regarding how to, in terms of wellness and how to deal with stress during this very difficult time that you want to share?
I do know, Dr. Giaccello, if you can allow me, that Wellness House does a lot of programming with Miles Square and the UI's Cancer Center. And I know in Spanish, in terms of like for Dolores and for the Latino community, I know there's a Spanish yoga that's sponsored by Wellness House and Ala's Wings that takes place every Saturday. If people, you know, are able to connect to Zoom, that's a resource that could be used. I could send a link for that. I'll post it on the chat.
And just to follow up with that, you know, just listening to the dialogue, we'd be happy to form some type of topic on just how to connect using Zoom. We have been talking about that at Wellness House, how to support individuals that may have the technology, or how to figure out how to connect individuals with technology, whether that's reaching out to family members, but just to walk them through our Zoom, our programs, because we've provided, most of our programs now are online. And a lot of programs that we've actually increased during this time is that stress management. So we're doing a lot of meditation, mindfulness, just for the whole kind of time. We're doing yoga, more Tai Chi, things that are more grounding and provide a moment of relaxation. So I can provide our information in the chat as well.
That's wonderful. And I'm glad that there's so many of you that are participating in this conversation. They represent resources and they know how to help each other. So this is wonderful. And we're going to be, like I mentioned before, doing a demonstration of some of the resources that are in the Chicago Check website about how many of you could be able to access them and know that they exist and that you could be able to take advantage of those that are available. And we're going to be discussing, and maybe some of you may want to bring that up, what additional topic. This is an early kind of first webinar that we are doing with all of you and others as we expand. And we just wanted to have just a general conversation about where people are at, what they're feeling about the different priority issues in their communities. But we also want to hear any future topics that some of you may want to suggest for future webinar. And we also would like to talk about how frequently you would like us to conduct this kind of platform, that we could come together and just chat and talk and see where we are as the pandemic continue, moving forward, and probably may last more than a year, according to some of the experts, with future challenges ahead. So think about those thoughts, and I would ask you again at some point to share with us. You could write it in your chat as well about other topics. It could be more focused on cancer treatment and care, that we could then get experts. They could be able to respond to questions and answer that you may have, or it could be about any other topic, unemployment, how to apply for unemployment, and what are some of the challenges in getting your unemployment forms and getting, your check regularly. So it could be of any topic that we would then rely on additional resource expert that could be able to provide very clear sense of direction. We could even invite someone from Medicaid, Center for Medicaid and Medicare, to talk about how you could be able to get insurance during this difficult period, how to navigate the system, and avoid some of the bureaucracy that sometimes we confront with, or any topic that you would like to hear from. And Alicia, how we doing in terms of time?
We're doing pretty good in terms of time. If anyone wanted to kind of chime in with any last comments that they want to make before I kind of transition into some resource conversation. So I did want to give you guys a minute or two if there's any additional comments you guys wanted to make, and then I can go ahead and jump into the next portion.
You know, this is Rosemary. One quick thing I thought of. I know that all of us who are on this call are involved one way or another with all of the issues, the resources that you have here on the slide. But some of the things, you know, I've heard that the unfortunate suicide rate has gone up during this time, especially among people who are kind of isolated, you know, those who don't have an income, those who don't have family. And one thing that I've been doing, I've been going through my phone book, and other single people like me that I know of that I may not have spoken to in a long time, I've just been giving them a call, because there are a lot of people out there who are not going to get on the TV or not going to have a Zoom call or anything. They're not going to look at exercise things that they could do, who are just sitting there in their homes doing nothing. And, you know, they may have this stress. They're not going to seek out a source that can talk with them, you know, therapy type things. So I've just been kind of calling people saying, hey, how you doing? And some of them, you know, will say, oh, it's kind of rough. Some will say, oh, I'm okay. But we know that there are people who are not okay, who are not going to reach out to a source that's unfamiliar to them. So if we can just pass this along to our friends or whatever, to just pick up the phone and give someone a call and just say, how you doing? And, you know, you may never know what it may mean to that person, because they may not let you know, but it's just a way of keeping that contact for those who are isolated. Because we always hear about someone who attempted suicide or what have you, and we'll say, oh, well, we didn't know anything was wrong. But if we just reach out and make that attempt, it could help someone out.
Oh, absolutely. Thank you for those inspiring words. You know, I think it's wonderful that people like you, even though you're going through your own difficulties, you're still thinking about others, and you're still reaching out and see how can you be instrumental in helping them or have some kind of support. So thank you, Rosemary, for sharing those ideas, those thoughts. I know that I personally have done that with a lot of friends that I haven't touched bases for some time now. And so thank you. And I'm sure that others may have similar ideas of how they're dealing with the stress and how they're dealing with isolation. It's very difficult to be not being able to see your relative. In my case, my grandchildren and everybody else, we take everybody for granted. Any further thought before we transition to Alicia to demonstrate resources and how to navigate them?
I just want to make.
Go ahead.
I just want to make a comment or an observation that when I talk to my students, there's a consistent group that I keep in contact with. They're located like in densely populated communities like Back of the Yard, Little Village, Pilsen, you know, and they're feeling a sense of cooped up. They have online courses during the day, but they're feeling like they're sensing when I talk to them, I sense a level of anxiety. Sometimes in these densely populated communities, the apartments are smaller. You know, you got 4 or 5 people in the house, and you do have a space where you can go and do your homework, and your classes, but afterward, you know, it just doesn't seem like it's enough up to this point to go outside and just take a walk. I just feel like they're just having difficulty. They have a heightened sense of anxiety, even though they're going out for a walk. It's just that they're being so isolated from their friends and having that socialization. We can internalize it because we're able, but when you're dealing with young people, they don't quite understand it. They sense it and they want to be safe for their families, but I just feel like it's a teapot, that's, simmering right now. And I worry about my students that reach out to me and talk to them because they just feel like they're cooped up and they struggle with wanting to socialize with friends outside at the same time keeping their families healthy.
Absolutely. Well, thank you, Henrietta, for sharing that thought, because sometimes we forget about the children and the adolescent, and they're going to their own, struggle and difficulty in coping. At least we are all adult and we already have other mechanism of dealing with situations like this, but they probably have they never have been exposed to something like this kind of pandemic. And so isolation and the suicidal rate, which was already high, particularly among those between the ages of 15 and 25, it was already high prior to the pandemic. So we are already seeing some data that indicate that it has gotten worse. And so we need to pay attention to them.
I think a component that, exacerbates their anxiety as well is watching their parents not working, unable to go to work, or some of the parents who are undocumented and working under the table, because we know that exists, are stepping out, right? And some of the youth are taking, leadership and saying, nope, in the hallway, there's other people, other apartments, take off your clothes, here, put this in, and they're trying to be those leaders. But it also adds anxiety to them because, again, they're in smaller quarters, and I worry about them.
Yes, absolutely. Okay, any further thought on anything that you want to talk, in this conversation that is very free-floating, very, for all of you to express yourself in whatever direction on this or many other topics. We open to hear your comments. I know that many of you have been spoken. We have about 40 people participating and only 5 or 6 has primarily shared some thoughts. Are there others in this conversation or listening that would like to share any final thought about how this pandemic is really affecting you, your family, your community?
This is Beverly, and I will say a few words as people think about what they would like to share on that. Thank you, Henrietta, for raising that. I think another issue that people have been facing is being in the same space and using that same space for different things. People work from home. They also have, like for me, I have 2 young children that I have to also tutor as well because they now have structured things. And then also I'm a student. I also use that space as well. So it's just kind of knowing how to transition from one activity to the other, but using that same space. So it's a little hard. And one thing that I also wanted to share was that people are sharing some resources via the chart, and that is very helpful. Thank you so much. And if people have more and are open to sharing some resources that they feel like has been useful and beneficial to them during this COVID pandemic, 19 pandemic, please feel free to share it as well.
And I've been looking at the chart to see if there's any question that any of you have, and I haven't seen anything except the list of resources that many of you so kindly have been sharing with us. But if you have any question or any comment that you want us to also bring to the attention of everybody else, you're welcome to do so. Okay, so then we should move to Leticia to be able to help do a demonstration about all the resources that we have available and how can people be able to take advantage. Or Beverly, I don't know if it's you.
No, I can go ahead and do that. So thank you everybody for your comments and feedback. It's all been very helpful in helping us kind of find the best ways to support you guys during this time. Again, I'm Alicia. I'm a community health educator with CHEC through Northeastern University. So I just wanted to take this time and go through some general resources to kind of help you guys and give you some tools to leave with. So let me just share my screen. Bear with me one moment. All right, can everybody see everything okay? Okay,
Good.
wonderful. So this is our Chicago CHEC website, and we do have a resource page on here that we just wanted you guys to be aware of. It's right here at the top of the page, and if you go ahead and click here, it'll bring you to our resource landing page for things. This is a good resource you guys can use to kind of go through and see other additional resources that we've compiled together. I'm just going to go through a few basic ones that I think could be helpful for you guys. So one resource that we found, there's a couple resource finder tools that we found that were really good, and one of them is through the Chicago Department of Public Health. So if I just scroll down here, so you can access it through our website to connect you to their resource response page, and scroll down to this section here where it says Chicago COVID Resource Finder. So if we click on that, it'll take us to the page. And I think that this is a really great resource because it's Chicago based and it's specific to COVID at this time. And there's search functions in there that could be very helpful to folks. So if you guys are looking for something more specific than what's offered here, you can search it in this section here. You can choose some of the prompted categories on the side over here, and you can use it based on zip code. So I'm going to use North Park's zip code as an example. So if I do that, it immediately will start pulling resources within that zip code. And it's kind of formatted very nicely. You can click on this link to get to their website. They provide some contact information here also, and a little brief summary of what's going on. If you wanted to do something more specific, you could even click on a specific topic such as food. If you're from if you wanted to do something in your student or your family-based or an immigrant population, if you were looking for specific languages, you could do that as well here in the filters. So this is a good tool to use to kind of see what resources you might have in your specific area and help them get you connected there. Another resource finder that we use is, I will show you from our website, excuse me, is this findhelp.org. This is a good one because it's not just for COVID-19. You can use this even thereafter. And it also connects you to a lot of resources. And you can search via zip code, just like the other one. And it's formatted a little differently. So if you prefer a different format for searching some of these things, this could also be a way to do that. There's a more specific search area here. If you're looking for something more specific, you can select a language. I'm Armenian, so if I wanted to go through my resources in Armenian, I could do that. I'll keep it in English though. And it'll help you prompt certain categories too, and even within that, you can look on these other subcategories that could help with your search. And again, it can connect you based on your zip code area. So when they kind of pull up their search engine, they've got a little map here. They've got some next steps, contact information, and ways to connect to those area. I know that the Greater Chicago Food Depository is a resource that we are in favor of for helping folks get connected to certain resources and for food and, excuse me, getting caught up in my words here a little bit, but it's a good resource to use as well. So this is one way to also help you get connected to some specific resources. And another resource that our community health educators had used to compile some resources together. I know that it's a lot of information we're kind of throwing at you, so we're trying to keep things a little bit more simple. And I know there's a lot of resources out there, so we're trying to help with that. And you can find it here on our community resources. It's the second link here. And if you click on the link, it'll take you to our spreadsheet that we've been compiling. It is ongoing, so we do update this with more resources that we find. So if there's any resources that you guys have provided to us in the chat that we don't already have in here, we'd probably be adding them to this as well. Sorry, my visual is a little off. So the way we kind of categorized it is down at these tabs. Down here would be the subject of what resources would be found in that tab. And we've gone through and created multiple ones in here to address different needs that we've found have been helpful to folks. So even here, we have our wellness house link to their cancer related resources and other information we think that could be helpful. If we're able to provide contact information, such as a phone number that might be easier for some folks to navigate rather than being online, we did provide that if it was available to us. And I will go, there's one other thing I wanted to show you guys on our website that could kind of be helpful just in terms of what we were saying with mental health and kind of getting out of that negative headspace that sometimes we find ourselves in at this time. And a lot of it is just being confined to one space, having to reinvent our spaces to accommodate our needs and our other responsibilities at this time. So if you were to scroll down on our page, there's some other little fun links to kind of help with that too. So there's some virtual field trips that you could do with your kids or your family. One thing I really love to do is look at the zoo and aquariums live streaming. And all you'd have to do is click on the orangey yellow areas and it would take you directly to that area. And you could, you know, go through some of these depending on what your interests are regarding that. So I wanted to open the floor if anyone had any questions, if you guys wanted me to go back to any resources, explain anything further, whatever I can do to kind of facilitate this kind of dialogue and get some feedback from you guys that would kind of help us better our process with getting resources to you guys.
Wow, Alicia.
Yes. I know, it was a mouthful. So thank you for bearing with me.
No, I'm cool. You know, I appreciate it because I haven't gone that deep into the website, and that was a nice tutorial. Thank you very much.
You're welcome.
Alicia, do you want to see the listing or testing site as that came out so people would know where they would need to seek? I think it was part of the Chicago Department of Public Health, I believe.
Okay. So right here, they kind of have it right at the top here to find a location for some testing. So you could go there and let's see here. Trying to find the search area. There we go. So all of these little orange dots are different locations. So I believe if you could type in a zip code, it'll kind of show you which locations are in that area. So you can see that here's one right here, and if I hover over it, it gives me, it's giving me a little grief. Then it can give me some information regarding this testing location and where to go. So it looks like these are some locations that you can look at to there that would be close to that zip code that I typed in. Is this kind of what you were talking about, Aida?
Yeah, just to give an idea about how can they be able to find a testing site close to where they live, or they could use it for themselves or refer family or friends about how can they be able to find those sites next, near their home. And this is wonderful. The information is easy to digest, to follow. It has clear, not only addresses and phone, but it also tells what you need. You know, you need to make an appointment in most instances, and you need to bring your ID, etc. So all that information is also included if you look into it, not only for the city of Chicago, but you have for Kankakee, Indiana, and you have for other parts of the state. So that is very helpful, particularly now that people who may not be feeling well and want to be tested, they should be able to know. And it tells you right there, the testing criteria, you know, if you need to be symptomatic, if you need to be a resident of that area, etc. So it really gives you some idea, so you don't have to go to a particular site and then find out that the criteria, that you don't fit the criteria for whatever reason, and you had to return back.
I had a question about a resource guide. What about people who not had access to internet or see the, you know, had like a paper resource to put it in stores, places like that for the specific communities?
So you're talking about some other non-internet related ones, so trying to get maybe some phone numbers and stuff of that nature.
Because a lot of people, they don't have access to internet right now, or not have computer or a smartphone. And I wonder how we can provide resources to that population.
That is definitely something we've been working on seeing how we can kind of work around that barrier that we've come across. So we are aware that that is something that's a big issue right now with the challenges of switching over to virtual communications and sharing resources, and not everyone has access to that. So that's why even within our spreadsheet, I know that it's online, but if there was a family member that could help them, there's some phone numbers that we've been trying to provide as well to kind of overcome that barrier. The only issue then becomes that it's still an online format that we're trying to provide that phone number to. So we're definitely—
So there are like hotline that the city of Chicago provide, and the state and the county, every level of government had a hotline established for COVID-19 to ask questions, resources, or whatever. I don't know in this side whether you have that hotline. I know that I tell people to go 311, which is a non-emergency hotline, and they could then, refer you, connect you with the specific service that you may be looking for. But I know that there is a designated telephone number that people can call.
Sorry, that thing I noticed when I use Resource Guide, I wonder how good is that resource, because sometimes I call and they not answer, or they say they're gonna call you, never call you. And I had a lot of experience with community members happen that kind of stuff. Even in my own experience with my brothers, I called OSHA to report situation. Nobody called me, nobody say anything, nobody respond, and I wonder about this resource guide is affected or really helping community members.
You are correct. That's a common complaint that I hear often, that the many hotline are not really, you don't have a live person talking to you, or it may take forever, or they take your information and don't call you back. It is a bureaucratic problem because many of the people are working from their own home, the workers that are part of the city or the state, and maybe they do have many other phone calls at the same time. So it is a problem. I don't know how we could solve it, except to complain to the city directly and to the state about why those hotlines are not being functional.
And I think you had also mentioned before that maybe if there was a way that some phone numbers were posted in public areas to help people get connected, if I'm not mistaken. So like if there's a way that we could partner with some local grocery stores to provide phone numbers for resources, but then again, we'd have to double check that those resources are credible and people can get through to them. So we'd have to do a cold call in that sense. But I think that that's definitely something we've been working on, and I'm open to if anyone has any suggestions on how to overcome that. And how we can kind of do our part with getting the right resources out with all of the barriers that we are experiencing at this time.
Do any of you online wants to see any particular resource to show you how to navigate or get to that particular website, whether it's housing or food insecurity or anything else that Alicia can be able to demonstrate? Are there any requests from any of you? I know that the listing including financial insecurity and food insecurity, you did demonstrate something about the Chicago Food Depository, and you also listed and demonstrated how you could be able to go into a soup kitchen where there are already meals prepared if people can be able to access those. Why don't you demonstrate something about shelter or, you know,
Sure.
for people who are in crowded homes and are positive and they need to live somewhere else for the first 2 weeks, 14 days, maybe how they could be able to access those resources that the city and the state have made available.
Sure. So I'll use the resource finder to kind of demonstrate how this guy works a little bit more too. So if we were looking for housing and shelter, and we could even put families, so that way it can encompass maybe larger groups of people. And you could even see here some resources that it connects me to in the area that I'm looking at. So, or the community that I find myself within. So they do connect us with some resources here. It looks like there is an emergency shelter request, and that phone number is 311. I believe, Aida, you were mentioning calling 311 for city services early on as well.
I had a question about housing. I wonder housing is provided to people who not document. They not have documentation, or just people who has a legal resident here or citizen. Because I know people need housing, but I don't want to give this information to someone they're gonna deny.
So one thing that I have found that has a lot of good resources is the Illinois Coalition for Immigrant and Refugee Rights. They have a lot of information on their website too for resources. And even when I've looked up on some resource finders too, and I select for immigrants and of that nature, they do direct us to that website as well. And they do have some good resources on here sometimes for helping with some of that. So let me see if I can find something right now. And if anyone else has some information that they know of, I'm open to let you guys chime in as well.
Catholic Charity sometimes could provide cash, you know, support to pay rent, and can have also a series of other resources that are, they usually provide even before the pandemic, but now they are expanding many of those resources to meet diverse needs of the population. So that's another source that people can consider.
And another thing that we can also do when we do have our future virtual check-ins for coming up, that when we do address specific topics, the CHEs can definitely compile more specific resources for that topic. So that way we can address topics regarding, resources regarding the topic that we'd be addressing at that check-in. So that's also something that to keep our eye open for in a way that we can provide them and have something prepared for you guys at that time for those resources.
Okay, thank you.
I'm not sure if I answered anyone's question or showed kind of the needs that they were looking for. So please let me know if you guys want me to continue moving into something more specific, or how best I can kind of support this aspect of the conversation.
Alicia, can you do something on PPE for
Sure.
quick?
That was 31 people. Ooh.
This is wonderful what all of you have been putting together. It's a wealth of information, easy to find, easy to navigate. And I really want to commend the staff and the staff and others. They have really made an effort in putting all that information.
They talking.
Joanne, I know that you're in. How are you?
Sorry to interrupt. Back on the housing issue, I know that for some people who may have a family member or themselves who have tested positive, but they're not able to isolate outside of their home, and they're living with other family members as well. There is information on the CDC website that goes over how to how you can protect yourself, or best protect yourself and your family members at home if there is someone in your home that has tested positive.
And here's where you find all the guidelines, and maybe we could try to look at what do this says in terms of masks, wearing masks in public location. And I think you have one there, cloth face cover. But it shows you how to develop one, but it doesn't say what are the guidelines in terms. See if your CDC recommend, okay, wearing cloth face.
So there's even a video here on how to put together a face mask from home. From the U.S. Surgeon General doing that. I can play that now if we'd like, or you guys can look at it at your own time, wherever everyone's most comfortable with.
I think they can play it on their own. We do have some polls. I don't know if there's anyone you guys want us to go ahead and share as well, because we have things like next topics that people are interested in.
Yes, why don't you go ahead and discuss that verbally? Yeah.
And I can stop sharing my screen if you guys wanted to kind of share some other things regarding that too.
Okay. So we do have some polls, which one of them is to kind of talk about topics that, next topics. I'm just going to launch it. And it says it's in progress. Let me share my video. So it says in progress. We do have a few questions, so it's going to give some people some time to fill the questions. Just choose as many. Let me know if you received it. Do you have it? Okay, yeah. So responses are coming in. Let me see if I can share that screen. Do you see my screen or do you see my video only?
Yeah, I see that lovely place where you are.
Oh, okay.
In the background.
So where do you press for them to select the topic?
I think I see some people have been responding. Let's see if I can share that as a screen. Okay. Let me know if anyone is still, I see you still coming in. Okay, I'm going to give it another minute.
Okay, so you put the children across the water over there?
I like it because when I see you during meetings, it keeps me calm.
Yes, yes, it does.
Okay, I think that most people have completed it, and I don't think anyone, so I'm going to click end. But from my end, one of the topics that came up as the highest is cancer topic screening and care. So I'm just going to end this and see. I'm going to also share the results. Do you see the results?
Yes.
Okay.
Yes.
Great. So these are the results. So I think the highest was cancer topic screening, diagnostic care, and survivorship. And then second is COVID-19 related topics. And we will definitely keep that in mind. And I will stop sharing results. I think we also have another poll that we would like to. I think another one was languages. In terms of languages, if there are other languages people would want to see this in, I only put some of the languages that Chicago Czech has. I apologize, I missed on Polish, but these are some of the communities that we've engaged with in the past.
You did not list it English, but that's okay.
Yeah, it doesn't list English because we have this one in English, but if there are other interests people would like to attend. And then I'll leave that for you. Okay. I think that most people have entered, and I am going to share results. So most predominantly is 60% Spanish, and then there are others, and some say none. Okay, so we will definitely, as we think of that, make that priority. Now, so stop sharing that.
And someone said, what are the other languages other than Spanish and Mandarin?
So for those that chose other, are there other languages other than Spanish that people are interested in having this conversations in? I'll also launch one more because we, our community steering committee, we're interested to know if people have heard about health, telehealth, and what it means. Wow, interesting. I'm going to share the results. 100% have heard of it and really know what it means. And then one more poll, and this is to know if you've used it, and if you used it, did you like it or enjoyed it or do not like it? I think the polls are in. Okay, I'll start to end that. And then I'm going to share the results. So majority have not used it yet. A good number proportion have used it and liked it. Very few have used it and did not like it in general. Okay, and then the only last one I think I have in terms of the polls is, so this is overall, did this conversation meet your expectation? I'll give that a few seconds. Okay, I will think most people have participated, and I'm going to share that 100% of those that responded say that this did meet their expectation. I am going to stop sharing, and I think that's all the poll we have. And then I'll leave it to, I think Joanne was on the call briefly. If she wants to say a word, or Ida, do you want to continue and end the meeting? We're about at 1:28.
Well, the only thing, this is Aida, unless Joanne or Henrietta want to say something else. I wanted to say that our plan is to do a similar kind of conversation, focusing in this case about topic related to COVID, more specific, based on our resources and time availability. We recommend to have this done on a monthly basis. And we wanted to make sure that you think that that will be acceptable to all of you. How many of you will be interested in participating again? And specifically regarding COVID-19, what will be your specific questions or issues, so we could be able to identify the appropriate resource expert that could be able to address them. Are there any comments about that?
Sure. I think that one of the things that's happening is that there has been a quiet movement for contact tracers for COVID-19. And I think that there needs to be a lot of them to go out there and find out where there are people or families that have been affected with COVID-19. And there is training available. It's not much, but most of it is free. And it's a training where you can get certified. And we also need to find out places where people, what agencies need contact tracers, COVID-19 contact tracers. I think that that'll be very, very important, not only as a good resource for the community broadly, but just for those of us who are involved in Chicago Check. I mean, this is another area, a whole new kind of area of epidemiology that we probably need to get involved in, because it's going to be with us for a minute, and we need to be able to provide folks with resources. So that's my recommendation.
So that could be something that could be discussed during our next webinar, contact tracing and anything related to that. What are the resources available to community-based organizations? Many of the advocacy organizations are really the city and the state who's going to be getting a lot of money for contact tracing, to make sure that they are done by people who have the community trust, who have the knowledge of the culture and the language.
Exactly.
And that we should be able to train people who are community-based organizations to be able to do that. And so, yes, this is a very important and very timing topic. So I think that we could center the next discussion around, covering contact tracing.
Mm-hmm.
And I know that we're running out of time. So thank you very much for all of you for participation. And I hope that you all find this conversation helpful, and we're looking forward to inviting you to the next one. Thank you very much.
Thank you.
Thank you, Aida.
Yeah, thank you, Henrietta and Beverly and Alicia and Joanne.
Absolutely, great job.
Well, have a wonderful day. Take care.
Thank you, everyone.
Thank you.
Bye.
Bye. Bye.